Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. Today the topic is on the head, the pelvis, and the feet correlation. I'm going to tell you first the main problems that occur in each of them. Then I'm going to teach you the solution to the problem. We'll start at the head. The head has 22 bones. The head is designed to be mobile. There will be a test. Every time you breathe, the head expands and rotates. One side goes back, the other side goes forward, all the way inside. So when we look inside the head, the main bone, the sphenoid bone, that's the orange bone, the orange bone in the middle, the sphenoid bone moves like a bat. The wings oscillate when you breathe. The sphenoid bone touches 7 of the bones. And it's important that it move freely. The most common problem with the head is the bone's motion gets infringed upon, meaning it reduces in its capacity to move, and if it's bad, it gets stuck. Would you like a notebook?
Yes, please.
Thank you.
You need a pen? Got one. Thank you.
That's a common trigger point or trigger for many headaches: hearing, vision, balance, memory loss, brain cognitive function. There are many things that occur if the cranial motion is hindered. I'm going to help you understand that and how to mobilize it. Now the brain itself is covered by a cushion. The cushion is called the meninges. I'll describe them to you. The brain tissue has a very thin lining, like I'll call it like saran wrap, like in the kitchen, very thin. It adheres tightly to the brain and spinal cord. And it's there for protection. Right outside of there, around that tissue, is fluid. It's called cerebral spinal fluid. And there's a barrier. Then there's another space with more fluid. The fluid flows down, and it flows back up. The fluid is made in the head and in the sinus, and it's called the cavernous sinus. And it's truly not manufactured, it's taken out of the blood. So you have very specialized single layer of cells, the pull from the blood fluid, water, sodium, chloride, some protein, some fat, some carbohydrate, minerals to bathe the brain and spinal cord. Your body makes about a cup, a big cup, about 600 milliliters per day, and it flows constantly. Now, cerebral spinal fluid is replaced all the time during the day and night. And in a 24-hour period, it's replaced about 4 times. So you have a small amount, like about 150, 200 milliliters of fluid around the brain to protect, to cushion. Now, next week our class is going to be on collisions. I saw a fellow last night who was driving a farm equipment with a lifter on it, and he tipped over and smashed his head and got a big bump. Fortunately, the cerebral spinal fluid cushion protected his brain. So we went to the hospital, had a CAT scan. The good news was there was no brain tissue trauma. It was skin, bone, and inside some trauma, but not, it was protected by the cerebral spinal fluid and the meninges. Okay, they're very important. And they're very accurate, they're very detailed. Sometimes people have a spinal tap where they check the cerebral spinal fluid. They stick a needle down in the lumbar spine and suck it out and check it. Sometimes people get meningitis where they get some kind of virus in that fluid. That's a bad thing because it swells, and when it swells, it creates compression.
What determines the quality and quantity of that fluid?
The tissue in the head that pulls it out.
Okay.
It's very sensitive, very highly specialized cells that extract from the blood the cerebral spinal fluid. When it's all done, it's dumped back into the blood and into the lymph. Okay? It's there for your protection. And the motion of the bones helps pump it, helps move it. Okay, now that's the head. Now, the next most common problem that presents, even in all doctors' offices, the number one problem is low back pain. Yeah. Most low back pain is correlated with pelvic malposition and abnormal motion. The pelvis has 2 big ilium, that's the big bone that holds the femur, and it has the sacrum. The sacrum is made up of 5 or 6 small bones that are fused together to create a foundation, a very hard, firm foundation to hold everything above in position. So when you stand up, all the weight of the upper body rests right there on the sacrum. Now, by divine design, the spinal column is built so that the sacrum starts at an angle. I'm going to pass this around for you to look at. This is a almost perfect biomechanical rendition of a body with correct balance. When you lay on the floor to do a sacral slide, you're putting the body pretty much in that position. On the back is another picture of the spine. I'd like you to look at it. It's not correct. It was online, but it's not right. And I want you to look at it so you can tell what's not right about it. This is correct, the other side isn't. But the pelvis is designed to start at a 45-degree angle biomechanically. So if we're engineers and we draw lines and measurements on the x-ray, that's what it's going to be. Now, most people have problems with the low back because of malposition and lack of motion in the pelvis. The most common improper position is pubis up, low back goes from a nice curve to flat. And when that happens, the head goes forward. So lack of a lumbar curve is always bad, because the lumbar curve is designed by God to give you a shock absorber effect. Okay? The bones are shaped such that the curve in the spine is normal because the bones are taller on the front. Up in where the ribs are, the curve goes the other way. You can see that on the picture. The curves go the other way. The vertebrae are a different shape. So that's going to be a test question. Lumbar vertebra, are they taller in the front or the back? Lumbar vertebra, are they square blocks?
No.
They're curved? Are they taller in the front or the back? The front. That's the right answer. By divine design to give you a cushion. Now the discs in between the vertebrae are always parallel, the level. The bones are what creates the curve. Now, I told you the most common problem is they get too far this way. So when you're working in the yard, in the garden, and you're standing in the kitchen, leaning forward, you reverse the curve. It creates a stretch on the spinal cord. It creates a stretch on the meninges. So what's the solution? The solution is, I want you to write this down. You start with the word A. A solution for a majority of low back pain is tipping the pelvis more with the pubis down. Most of the women won't understand this, but for men who have a problem, I teach them to slide forward on the hard chair and get a can, put the can right down here between the heels, and do what I call the pee and can exercise. You think you could do that? Yeah. You have to tip the pelvis down to get the can. If you don't, you're going to miss the can to get your feet all wet. So you tip the pubis down. When you go to church or you fly on an airplane, and you get tired and bored, and you slide down, you're doing this. And that hurts the low back. That then creates a complication that goes upward, clear up to the head and neck. Now, I'll show you a neat design. When God designed the pelvis, He built in for you, He built in a rocker. So when you turn the pelvis upside down, you have like a rocking chair. So if you sit on the chair, you can rock. And if you're like a teenager, you want to go back and sit on the back of the rocker. But when you get wise, you slide forward far enough. Your wife says, You have to pee? And he said, no, I'm just practicing my pelvic positioning for normal. Now we're going to go down to the foot. How many bones in the head?
22.
22. Who said that?
Me.
How many bones in the foot? 26. 26.
26.
Now, I did you a favor. Some of you are non-believers and don't believe the body's designed in the image of God, and don't believe that it can heal itself if you put things back where they belong. And part of today's class is to help you understand how to put things back where they belong. I think your mom taught you that when you were a little person, right? Put things back where they belong. That's what I'm trying to help you do. And if you do this routinely at nighttime, then while you sleep, your body does what?
Heels.
What?
Heels.
It heals. How much?
Micro bits.
Micro, teeny bit. Just a little tiny bit. Whatever little bit helps. Okay? I copied this right at the end of there. The cuboid bone. The cuboid bone happens to be one of them in the foot. Now, I told you before, every bone in the body, and how many are there? 26 total, have their own shape. The cuboid bone happens to be like the sphenoid in the head, very unique. So I'm going to pass this around. If you get bored listening to me, just read it. If you don't get bored, just scan it and pass it on. Now, by divine design, God didn't want us down walking around on 4 feet, so set us up like him and designed the foot with a back foot and a front foot. So in that little contraption, you have a front foot and a back foot. And it's important that you understand that. And it's important that you not get hobbled. Any of you know what hobbled means?
Feet tied together.
They're tied together. You used to do that on the farm, right? Mm-hmm. Sometimes you have a cow that's kicking things off and you lock her legs together. You can hobble a foot. So first of all, the back foot. When you walk, the back foot heel is rounded on the bottom. You hit and roll those 2 toes on the outside. That's the rest of the back foot. When the tibia and the upper body crosses midline and is now going forward, the weight shifts from away from the back foot around into the ankle onto the front foot, those 3 toes. Okay? Now if you look at the picture, you'll see that the leg comes down into the foot. Where? Is the leg in the middle of the foot? No, the leg is in the back of the part of the foot. So when you stand, like at the kitchen, your weight should be where?
On the back.
On the back. On the back. On this portion, if I took all these off, that you have a little arch. That's where the weight should be. And if the weight is there, you have no weight on the front of the foot, the big toes. Now, I saw a young man this week who came in and he's 18 years old. And the main complaint was flat feet. I saw another one this week, 32, main problem, flat feet. Why are the feet flat? Because the body has been tipped forward excessively, too much, too long. The small muscles, the little tiny muscles underneath the feet get tired, and they then go like this. Guess what? Now we have pronation. So if we talk about the main problems that occur in the feet, it's pronation, number one. Number two, plantar fasciitis.
What exactly is that?
This is the plantar surface. Fasciitis means there's inflammation in the fascia, the tissue, that's a soft tissue. So you get very painful, chronic low-grade inflammation in the soft tissue of the foot because of constant re-aggravation. So you have exceeded tissue tolerance by torso forward, or head forward, causing fatigue, causing stretch. Now think of a bow and arrow. If that were a bow, and we put the bow string on, we want the string to be the right length, or the bow doesn't work right. And by divine design, God gave us 5 separate sets of muscles down there, and there are many layers to hold the foot like that. But they fatigue, and when they fatigue, they go down. They get inflammation, they get a lot of stuff. So what can you do about it? Modify your posture whenever you can. Practice, practice, practice. Standing with more weight where it belongs. That's number one. Number two, if you have a chronic problem, you can simply get something like a golf ball near bedtime, put your foot on it, right here, where the tip of my finger is, to help unhobble or separate that right there. Gently roll the ball like that, and then roll it forward and back between those toes. How hard do you push? About as hard as you push on your husband when you try to get him to do something, or your wife. How hard do you push on her?
Not very hard.
Not very hard, yeah. Nice and gentle, nice and easy to recreate motion, balance, and the alignment. Make a note of this. The alignment is done by innate. What is innate?
The way it's designed divinely.
The divine design. Innate is the power of God within you. It's the wisdom of God, the life force in your body. Innate is in all living things. It's in the grass, the trees, the flowers. It's in your body, and it's always 100% present unless you cancel it out. You can cancel it out, or you can turn it down by disbelief. So when you're told you'll never heal by a doctor, oh, we can't fix that, we have to cut it out, or you're going to have to learn to live with it. That's a lie. The body can heal by divine design. In my book, I say the more you believe in something that's true, the greater the power. You could give a talk in church with that. The more you believe in Christ, the greater His power in you. The more you believe your body can heal, the better it can. And if you believe it can't, it won't. The problem is, you're all in a hurry. You want to fix now, this week. That's where the surgeons come in. Oh, you don't want to wait? We'll just cut that and give you a new one. My boy, I saw yesterday, he was 32. I told him, you will have a knee replacement. I bet anything I have in 20 years, if you don't correct the feet, your knee's going to go. Why? Because when you have pronation, look what happens to the tibia. Boom, it goes in. So guess what happened in the knee? Boom. Now the knee is not functioning straight because it's tipped. Does that make sense? Mm-hmm. It's bent. I saw a lady yesterday I've had her doing homework to help straighten her knees by putting a book between her knees because her legs go like this. When she does this, her feet don't go together. She can't get her feet together. The feet are that far apart because the knees go in and the feet are down. So we're trying to fix her feet, her spine, but also her knees. And what does tissue do automatically? Replaces. You get new tissue. So see, what's a book between the knees? And if any of you are knock-kneed, or a lot of you have grandkids or children who have knees together. When they stand, their feet are apart. They can't get their feet together. Have them put a book between their knees and go like this with their feet, and retrain the new tissue to be more straight. Did that make sense? Okay. So that's the foot. Now, let's hook them all together. When hook them together, we have a balanced spinal column, pelvic unit, and feet and ankles. If we're to hang a plumb bob, some of you know what a plumb bob is. If we hung that on your ear, you would not be happy. It's about some of you wear earrings that are long. Where do you think the earring should be?
At your ankle.
What?
At your ankle.
If it's that long, yes.
At your shoulder.
Should be all the way down, straight down. That vertical line that I drew on that picture is the normal full spine. So if you take a full spine x-ray of you standing from the side, we draw a line straight down from the atlas vertebra. It should be right at the neck, at the bottom of the front of the neck. Going down, it should be right in that line should be right in the middle of the third lumbar vertebra. The third lumbar, you have 5 lumbar. It should go right through the femur, right through the knee, and end up down. It's called the lateral malleolus, right there. That's normal vertical posture. Now, question. How much energy do you think you save when you're standing neutral? A little or a lot?
A lot.
What happens when you're forward? Do you spend more energy or less?
More. Your head gets heavier.
Yes, your head gets heavier. What about the feet?
More stress.
Way more stress, so much that they can break down. What about the low back?
Same thing.
And you know what? I told you the most common problem people go to doctors is low back pain. When people go to chiropractors and massage therapists, one of the main problems is always, oh doc, I'm really tight right here behind my shoulders and my neck. It's all really tight back here. Will you fix it? And in my mind, I'm thinking, why? I can do what Denise does. I can spend 20 minutes, and she loves to do it, right? And she's very good at it. She'll work those muscles out, get them all relaxed. And then you go out and sit in your car, and you schedule the next appointment. Guess what happens to those muscles? Tighten back up. Why?
They're too long.
Too long.
I have a question. After you work on someone, is it a good idea to walk a little bit before you get in your car? Because I know that as soon as I get in my car, I'm toast.
Okay. The answer is, it depends on what? How you walk?
Okay, if you walk correctly, posture upright, is that
They
good?
come out when you stand up, take about 2 or 3 seconds and get all the way up. All the way up. Then start walking. If you don't, you stand up and you get part way and you go for a walk. No, don't walk. No.
But we students understand we need to be upright when we walk. So if you get out of here and go to your car before you get in your car and you walk upright, then it would be a good thing because
True.
does it help
I totally agree. Totally agree.
rather than immediately get in your car and drive away?
Yes.
Okay.
Now I have a window. And I watch people go and get in their car. And sometimes they say, damn. Don't do that.
Yeah.
Walk slower and get more vertical. So let's fine tune a little more. Let's talk about the head. By divine design, your body will create, if it can, balance. Balance means your head is level. Now, when I was young, my dad used to talk about our neighbor who was a level-headed farmer. I didn't know what that meant, but now I do. He had his head on straight. His head was level. He was not skewed, he was not tipped, he was not too far forward. He had his level. If you have dentures and you go to a really good dentist, when they get the dentures, they'll align the teeth so that the hard palate is horizontal. And the atlas vertebra is horizontal and loose, so it can tip and move when you tip and move. When you tip forward and stay there for very long, you're stuck. Things get tight and they get stuck. When I check people, in my mind, I kind of categorize it. Does it have normal motion? No. Is it restricted? I mean, it's moving, but it's not moving completely. It'd be like the door. The door, something's wrong and the door won't open all the way. They can get out, but it's not wide. Then it can be almost immobile, or it can be stuck, which is worse. Too loose or too tight? Too tight. We don't want it to be stuck, especially the head and the pelvis. Okay, let's now do this. Do you have any other comments or questions?
So to take the pressure off the lower back, you you tip your pelvis forward like this
Yes, ma'am.
instead of back.
Yes, ma'am.
Don't tuck your butt.
Don't
Be a woman and stick that thing out, right?
see that's
They used to
my
tell
whole
us
life.
how to
I've
walk.
been told
Tuck
right?
your butt.
Sucking your tummy and then
Tucking your
move your pelvis, right? Isn't that
Yeah.
what you would talk?
Yeah.
You can still suck your tummy in, but stick that butt out.
But don't tuck your tail.
Your husband wants to see it moving.
There's an emotional component there. When you've been taught the other way, you feel a little bit vulnerable sticking your tush out like that. So, anyway, but that's gonna take some practice,
Great training.
real training.
That's why I have class. And part of my challenge in helping you become more healthy is to undo the false training and get you to stop doing the things that are not working. Now, most of you came to get help for some problem or another because things weren't working like they should. Now, some of you want to keep doing the same thing and expect a different result. There's a definition for that.
Idiot.
It's called what?
Idiot.
Insanity. Insanity. Do the same thing and expect different results. Now, I know from experience that to train the new tissue, it takes time. I'll say that again in a different way. We're not trying to train an old dog to do new tricks. We're trying to train the puppies. And the puppies are for you, it's the new growth of the new tissue that's coming in. And it comes in every day, you get new tissue. I told you about the cerebral spinal fluid. Your body makes a big cup of cerebral spinal fluid every day. It does not recycle the old stuff. You get new cerebral spinal fluid about every 6 hours. It's all new. You get all new red blood cells within 120 days. You can go home and mark in your calendar today, August 17th, right? And we count September, October, November 18th. All red blood cells that are in this room today will be dead and gone. They will all be replaced with new tissue. So when you've been trained I've been trained my whole life to tuck my butt. I had a sister who went to charm school and she learned to tuck her butt. That's really good for the government. Because if you tuck your butt, you're going to get sick. Because you're tipping the pubis up, you're modifying the low back, you're changing the head and neck, you're developing health problems you would not have had if it would have raised your rear end up, got the good lumbar curve, got your head level, and maintained normal balance. If you have this posture, you can fix stomach problems. You can fix lung and liver and brain and all kinds of problems. Why? Because you have more energy. When we have bad posture, you have less energy. Now, if you want to check what I just said to you, go visit a senior center. Walk around and look at all the people in there. The ones with the worst posture have the most serious handicaps. Physical, mental, chemical, emotional, spiritual, and there's nothing worse than have a fairly good mind in a body that doesn't work. That's very common. because they did not know the rules. They were taught wrong. They weren't taught about the feet. And again, if we go back to the feet, back to the neck, if you have a tight muscle, I would like you to think of an elastic. If I have an elastic band and I make it tight by stretching it, how do I make that tight band, elastic, muscle on the shoulder, low back, how do I make it relax? Shorten it. So when you stand, if you have a tight shoulder, neck, you stand in the T-zone, which way do you lean? Forward? Back. Back. And if it's on one side, you rotate, lean a teeny bit. Now, the weight of the head is 10 to 12 pounds. If the weight of the head is too far, you do too much, create another problem. So I want you to think of a bowling ball. You want to tip the bowling ball just enough that it's going to roll that way. Okay?
I have a question.
Yep.
About posture.
Yep.
So, and the T-zone. So to be able to get this good posture, how do you use the T-zone for that?
Perfect question. First of all, you're going to stand on it. Hold on to first. You're going to lean forward or back.
Back.
What are you going to do with your pelvis?
Tuck it. Tip it
Tip
forward.
Pubis down,
Screws down.
butt up.
Butt
What are you going to do with your chest?
Okay.
I get in trouble when I say this, but you want your butt and your boobs up. Okay? And where do you put your head? Try to get in the middle. Now the good thing about the T-zone is if you just stand there and move, your body will innate will try to put your body back so that you're balanced. That's the way you stand. And when you do that, I'll give you another couple medical words. You're doing neuromuscular reeducation. And that's what your 2-year-old, 1-year-old great-grandkids are doing when they learn how to walk. When they learn how to walk, they're doing neuromuscular reeducation. And what are they trying to do with their head? Balance it. Balance it. I have a grandson. We always laugh when we talk about Cy. He's a skinny little 1-year-old kid with a big head. His dad, Adam, has a big head. Cy got a big head too. And to watch him walk was, I always smile when you watch him try to balance his head. He finally grew into it, but now he's straight. But your body will try to do that automatically. Okay, let's go to the test. Number 1, the majority of problems with feet are due to head forward posture and general anterior, that means forward, leaning of the torso. Number 2, the cranium, much like the chest cavity, expands and contracts while deep breathing. True. Now, if you're doing the cycle slide, and you're shallow breathing, you're not getting as good a therapy, as much benefit as if you breathe in deep through the nose, pause, out through the mouth. The head moves more when you breathe deep. Number 3, stuck cranial sutures can have a negative effect upon blood, lymph, and brain function. How true? Very true. See, if you get, like my friend did yesterday, he was on the tractor and he tipped over and smacked his head. So when I checked his head last night, it was bent. It was stuck. It was torqued and stuck crooked. Now, if the head is crooked, what happens to the jaw?
It doesn't hang right.
It doesn't hang right.
You get TMJ.
TMJ. Number 4, the meninges, or the 3 layers, the covering of the brain and spinal cord. It contains cerebrospinal fluid, which cushions, cleans, and protects the central nervous system. True. Today I talked about the covering of the brain. Then there's another layer. Then there's another layer. The 3rd layer attaches to the bone. So inside the head, all this inside the head is lined with another coat, another layer of that thin wrap, the bones. Now you know what I'm talking about. If you eat ribs, right? That's what it is in here. So you have 3 layers, and you have fluid on both sides of the middle layer to cushion you. So your brain is like a baby in the womb. Most of you have had kids. When the baby's in there, in that fetal position, you can ride a horse, you can ride a motorcycle, you can run, you can sleep in your belly. The baby doesn't care. He's just in there hanging out. Okay? Now, after you're 2 years old, you should never go into that position. Some of you do. I had a fellow who turned 70 last week. He complained of low back pain. We're trying to find out the trigger. Why the low back pain? Because it only happens when he sits and drives. He drives a truck. It only happens then. And we determined that it's due because when he sleeps out. Goes up. So his body always stretches. And what happens to stretch muscles?
They hurt.
They hurt, and they pinch nerves. So
I have a question on the head and then
the head and what?
the meninges.
Meninges.
Or the spinal, I guess it's the spinal fluid. When you hit your head on the right side, your brain is thrown to the left side, and so it bruises on the left side rather than on the right side.
Depends on how hard you hit.
Okay, you'd have to hit pretty hard to bruise your left side of your brain.
Hold that thought. We'll talk about that in detail next week, okay?
Oh,
That's a car accident discussion.
okay.
If you hit your head easy, I'll say that the brain gets hurt on that side. If you hit hard, it gets
That
both.
is-
The pelvis, number 5, which contains the sacrum, provides immovable yet somewhat stable foundation for the spine, and all upper body weight thus associated, including the head. True. That's why those bones are solid. The sacrum is a very dense, stable foundation.
I have a question. So when you're sleeping, if you're a side sleeper, is it a good idea to put something between your knees?
Always between knees and feet. Bend your knees slightly. Bend at the pelvis slightly, not like in a chair, just slightly. If you can, find a warm husband to put your cold feet on. Have him sleep back there.
Or vice versa.
Number 6, the functional effective head weight is A, 10 to 12 pounds when balanced. Yes.
Yeah.
B, head leaning 15 degrees forward, 27 pounds. Yes.
Wow.
C, tilted 30 degrees forward, 40 pounds. Yes. Now they prove this in colleges that have medical school and do all kinds of measuring. Number 4, D, when looking down 60 degrees at a mobile device, your head has a 60-pound effective weight on the neck.
No.
And they complain, oh, my neck's tight, my neck hurts. And if you do it long enough, your neck thinks that that's normal. No. I like to lay on my back on the floor, do sacral slide every night. Why? To get the head back. You know a lot when I'm working, checking the feet, I'm leaning forward. So I have to do that to undo the stress. Number 7, most TMJ joint problems, pain, and clicking is due to a distorted skull. True. So think of a metal swing set in the park. Metal pipes. I'll get it all set up, and somebody comes in the park with a lawnmower, a tractor, and they bump the swing and bend one of the pipes. Now the swing set kind of skiwampus, crooked. And you get in the swing, put your grandkid in the swing, pull him back, and let him go. Boom, he swings crooked. So if you have a crooked head, you will have a TMJ problem. Now, could I say that the other way around? If you have a TMJ problem, you probably have a crooked head. True. I had a young lady who was told by a chiropractor in town, oh, your jaw's off, you need to go to this specialist in Boise who does TMJ aligning. And I didn't want to go because it was going to be a long trip, a lot of time, and very expensive. So they thought they'd do the cheap way and come see me. So I checked it. First of all, I laid the little girl down. I said, okay, put your teeth together. Her bottom jaw was almost a full tooth width. When she opened it, it pulled crooked. So I said, yeah, she's a jaw problem. Now let me pause. I want to tell you what a specialist is, so you understand, for sure. You can take this to the bank. A specialist is a doctor in another town. People go from Idaho Falls to Salt Lake to specialists. People in Utah come to Idaho Falls to specialists. They go back and forth. That's what happened in Colorado. I had people go in Colorado, they go from Denver to Colorado Springs. They go both ways. Why? Because specialists get to see you occasionally. The real guy who's stuck with you has to deal with it all the time. Does that make sense? So I showed the mom how to do the microcranial mobilization, how to do the occipital release. Mom did it faithfully. The girls did it faithfully together. I checked them periodically. In less than 9 months, the jaw is straight. The jaw now is, when she opens her mouth, the teeth are aligned because we remodeled the shape of the head. How long did it take? Many months, but now it's fixed. Okay, number 9. Both the occipital release and the microcranial mobilization techniques enhance cranial motion, balance, alignment, and thus brain function. True.
Did
10.
you do number 8?
8. While correctly doing the sacral slide, there's a positive mobilizing and aligning effect in the neck, the ribs, the sphenoid bone in the head. True. I have a number of people who have digestive disorders because the thoracic spine, the mid-back, is distorted. That almost always comes from a distorted pelvis. I saw an 18-year-old girl earlier this morning. Second time, 2 weeks ago, she had digestive problems for, when I asked her how long, she said, my whole life, my stomach hurts all the time. She's been to a lot of doctors, they've done a lot of stuff. She has been doing the sacral slide, the occiput release, all this stuff. Today I saw her, my first question, how's your stomach? Do you have any pain? She goes, no, I haven't had any stomach pain for more than a week. So why? Her body fixed it. Now, is she done? No, she needs to keep doing it. But she doesn't need me, she just needs to keep it aligned and let the innate fix it. Number 10, the best, this is not a trick question, the best time to do active self-care is A, morning, to ensure the best possible alignment and function. B, noon, because good motion, balance, and alignment are more important than food. C, bedtime, so that the body can repair and remodel toward improvement and normal tissue function.
See, but you can do it anytime.
Yeah, C. And if you put them in order, C is best, A is next best, B is third. You get them all. Okay, are there any comments or questions? Denise, do you have anything you'd like to correct me on or add or subtract?
You were 100% correct. People, I want to go back to the low back thing real quick because we get stuck on that, and it's a huge deal. Low back pain is huge. I'd say 99.9% of the people that come to me for massage, they have low back problems, right? Same thing with Dr. Smith and all the other doctors. But you can sit in your car when you're sitting there. You can buy a little cushion to put back there where your low back. You're doing therapy in the car. If you're sitting at church, grab a book and put it right behind you. If you're doing therapy at church, because I don't know about you, but the pews are not comfortable. I think they're designed that way to keep us awake. I'm just kidding. But there are little things you can do all the time. You can do the pee in a can, even if you're a female. Sit down on your whole body vibration and do that. There are things that you can do to help that. When you help that, it helps everything above it, right? And everything below it. So, and you can do a lot of these therapies.
And anytime you help anything, you've helped everything.
Yeah.
I told you that the bottom of the pelvis is like a rocking chair. You can rock forward and back. Let's go to church. If you put something into the back third of your rear end, the pelvis will go down. Now, don't use a songbook. Use something thin, just enough to tip it. If you fly in an airplane, the airplane seats are tipped with the back part low. Always put something in to raise it up. A book, a pillow, a blanket, if you're lucky enough to get a blanket anymore.
A water bottle.
Water, anything. In your car, if your car seat is low in the back and it's adjustable, lower the front. You get the back up to tip the pelvis, pubis down. Slide forward so you're not reaching for the throttle on the brake. Get upright, head, pelvis. The same principle applies. When we talk about sleeping, you want to take the normal spine and lay it on the side and keep it lined up. Okay, thank you very much for being here. Send your sick friends. They need to learn. They've been taught wrong. And any of the therapies that I've taught you, you can do safely without any fear or worry. If you do them like I tell you how to do them, you will help people. And if you help people, you'll do better yourself. And now when you go out in the world, and you look at people's posture, you'll hang your head and cry. There's a lot of bad posture out there.